Okay.
So welcome everybody. For those of you who don't know me, I'm Dr. Deb. I'm the owner of Serenity Health Care Center. I have the pleasure of being with Andrew tonight. So we're going to have some fun. You guys on Instagram, hello. On Zoom, hello. And then I have a Zoom over here too. So we'll record the whole lecture with the screens, and then we'll also send it out to everybody after the thing. So if you're not seeing all of the slides, don't worry about it. We'll send them out to you guys too. You'll have the recording to listen to and share with other people later. So what we had planned for tonight is I'm going to talk a little bit about the medical side of mold and what to expect and what different mold toxins do. Andrew's going to share with you building things, inspection things. That's where a lot of questions come up from a lot of our clients, and I'm sure a lot of his clients too. What do you do? How do you do? How do you manage? How do you find a company? All of those kinds of things. So he'll give you all those tips and tricks. And then we'll just kind of open it up and we'll do a Q&A and we'll just have a nice conversation. So that's kind of what's planned for tonight. I'm very informal. So if I go over something and you're like, hey, can you repeat that or explain it a little differently? Feel free to just jump in and you won't disrupt me at all where I'm at. So we will get started. So we're going to talk about the medical mystery of, as soon as I figure out why this isn't going that way, there we go. The medical mystery of mold. So that's always the big masquerader of mold, right? Is it mold? Is it Lyme? Is it parasites? Is it this? Is it that? And why would we on earth ever think it is mold versus thinking it's something else? And if you do have mold along with some of these other things, what the heck do we do? Because it just makes everything more complicated. I'm not going to focus a lot tonight on treatment. We can talk about it in the Q&A, but I thought we'd talk more about the different types of mold and the different types of symptoms that you have. So then we can talk about cleanup and things like that. So first and foremost, is there a problem with mold? And I think pretty much everybody these days recognizes that there is a major problem with mold. And unfortunately, with the last couple of weeks of all the flooding, it's going to be even a bigger problem. Just a lot of people don't realize it yet that they're going to have this problem. So when we see people with mold issues, they have typically bounced from person to person to person. Many times by the time they get to someone like myself, they have already seen 15, 20, 25 doctors, spent anywhere from $50,000 to $100,000 before they even get to us, which becomes a big major issue. Because by the time they figure out what's wrong with them, they don't have any money left and they don't know what to do. They will have been given many diagnoses by the time they reach us with a mold mycotoxin diagnosis. It's not uncommon to see fibromyalgia, rheumatoid arthritis, chronic fatigue, somatic disorder, depression, bipolar disorder. There's a whole host of diagnoses that people will get. They'll be called a hypochondriac simply because mold comes with so many symptoms that conventional doctors don't realize that it's possible to have that many symptoms and have it be one problem. So they get confused sometimes. And because there's not always a very distinct pattern, they don't know what to do with it. And because oftentimes there's one or two people in the household that are affected, but not everybody in the household is affected. That also makes it challenging, not only for the diagnosis, but also for the family. Because there's usually some fighting in between that goes on between spouses if one partner is ill and the other one is not. It's a lot of money to renovate and nobody wants to spend that money on renovation. So it can be somewhat of a challenge in that too. So 24% of the population cannot genetically clear mycotoxins. If you follow Dr. Schumacher's work, he's the founder of the HLA haplotype. So they have a genetic mutation that doesn't allow them to remove not just mold toxins, but other toxins as well. And that's in part why we will see some people in the house get ill from it and other people don't. And you can all be exposed and have the same mycotoxins on a blood test, but somebody's sick and somebody else isn't. So genetics are great. Mycotoxins actually were biological weapons. They're warfare. They're meant to damage the nervous system and cause people to become very ill. But we don't like to talk about that type of warfare or germ warfare or COVID warfare or whatever we want to talk about there. Lyme is warfare too. It is a multi-system issue. So a lot of times when people are looking at their symptoms, they don't always come across mycotoxins, but they'll come across Lyme disease. Those symptoms mimic each other quite a bit, and they overlap with each other. And that's where it can be challenging sometimes to figure out what's causing what. So mycotoxins are very small particles of mold. So oftentimes we just say mold, we don't say mycotoxins, but you're actually ill from the toxins that get released from mold, not just the mold itself. These mycotoxins are small enough that they can cross the blood-brain barrier and inflame the brain and can cause inflammatory conditions of the brain. Sometimes we'll see white matter brain disease that occurs, and people will get a diagnosis of MS when they really don't have MS, they have toxins instead. And we have to get those toxins out. Mycotoxins do damage our mitochondria, just a big word for cell structure. So when they get in, especially in children, but we also see this in adults too, and they start to change the cellular structure, we will start to see increased risks of other diseases like cancer, lupus, autoimmune triggers, things like that. Oftentimes gut issues will occur as a result of that. Mycotoxins themselves do reduce glutathione. Glutathione is an amino acid. Most people know of it as a detoxifier, and that's what it's used for. Your body makes glutathione until it doesn't. And if it doesn't, because you have a genetic mutation that doesn't allow you to do that, or the mycotoxins have reduced your ability to make glutathione, then you can't detox properly. And then that's where these toxins build up inside your body, making you feel even more ill. And that's sometimes why when we give glutathione, some people will feel worse before they feel better because they're dumping all those toxins and they're moving them. And the body's really good at kind of compartmentalizing these toxins because they're protecting your main organs from making you more sick. But once you start releasing them, more inflammation happens. You feel worse. And so that's why some people feel not so great with glutathione. Most people feel pretty good with it, though. It can trigger, like I said, autoimmune issues. So it's not uncommon for us to see a false positive rheumatoid arthritis or lupus, or you'll start to develop things like celiac disease as a result because it's decreasing that immune system. The immune system starts attacking itself because it's trying to kill the mycotoxins, but unfortunately it's killing the tissue instead. That's pretty common to see happen. And then if the immune system gets depleted enough, then that's where we start to see increased risks of cancer and different types of things that are caused by the immune system. So you can see why there can be so many systems involved because it affects so many parts of the body. So we'll talk about symptoms a little bit too, but that is why it's considered the silent thing and a multi-system issue. So it is not uncommon for us to see neurological issues. Oftentimes we'll see patients, by the time they see us, they may have had a diagnosis of Parkinson's or MS or even ALS, which is pretty end stage at that point because it truly affects the nervous system. So you'll see numbness and tingling and brain fog and the inability to walk really well, or you'll trip over your feet. Part of that happens because the brain's being inflamed, and then it damages what we call the myelin. So myelin is the protective coating over the nerves. So if you think of an electrical wire, you have the plastic coating over your live wires. If the myelin starts to get stripped away, those live wires are exposed and then they start to become inflamed, and that's what causes your neurological symptoms. If we can get rid of the toxins that stripped away that myelin to begin with, there are ways that we can rebuild the myelin, put that protective coating back over the nerves so the nervous system isn't so much on fire and isn't causing a lot of symptoms for people. So you'll see cognitive issues. The first thing you'll see people complain of is brain fog. As that gets worse, they'll have more dementia-like symptoms, more Alzheimer's type symptoms, that longer term memory. It starts with short-term memory issues. Where did I put my keys? What's your name again? What's the name of my favorite show? And then as it goes on, you'll have more long-term memory that occurs. I can't remember what I did when I was 12. I went to my favorite place. What the heck was that? You'll start to get some of those bigger memory issues going on. Mood issues are very common. Anxiety and depression with mold mycotoxins is huge. Bipolar disorder is huge with mold toxins. I walk into a building, it's got mold. I get a hit. We call it a mold hit. They get brain fog. They start to get moodiness. Some people are crying. Some people are just really irritable. They can go from 0 to 100 in 3 seconds flat and then walk out and they're like, oh, I don't really know what's going on. I've seen people walk into a moldy environment and literally their whole body just starts shaking. So they look like they're having a Parkinson's attack just from one episode of a moldy exposure. especially once mold's been cleared up in their body, they're more sensitive. So it's common for them to have more of those intense neurological symptoms. Um, Sensory issues, oftentimes very sound sensitive, visual issues. Some people, the only symptom they have is when they walk into a building, they lose their sight or they get really blurry. They're kind of looking at their glasses going, gosh, are they dirty? What's going on here? Or their eyes will get really inflamed and they'll have more eye pain. So those are pretty common symptoms that we see. You just kind of feel, most people will say, I don't feel like myself again. And they'll feel better when they're away from a building, but when they get back into a building that has mold, they'll start getting their symptoms. I feel better when I go to the beach. I feel better when I go to my mom's house. But as soon as I come back home within an hour or two or 24 hours, I'm getting these symptoms again. It's usually a good sign that something's going on with that building. We call it sick building syndrome, and Andrew will talk to that, I'm sure, a little bit more. So the immune system is in chaos when we have underlying viruses and bacteria and we bring mold into the mixture. Boy, it's a heyday in there. It's a party. So all these things like to start to share each other's genetic makeup. And the reason they do that is because they're stronger together than by themselves. So if they start sharing each other's genetic makeup, they can stay there longer. And then when we deploy something to try to kill them, they won't recognize it as well if they're sharing that genetic makeup and hanging out to each other. So when people have things like Epstein-Barr virus or the herpes family virus that causes cold sores, or HHV6 is another one that's pretty common, that typically we see causing fibromyalgia, mold will make a lot of those things worse for people. Mold will also decrease your thymus function. So your thymus gland sits in the middle of your chest. That's what gives us our immunity. And as we get older, that thymus gland shrinks and we don't have such good immunity. And so when you have a mold exposure, it makes that shrink even faster. And so the immune system is worse. So a really good way to stimulate your immune system is by tapping. If you've heard of tapping, you just literally lightly tap your chest right in this central area and it stimulates the thymus gland so it can start to function a little bit better. Frequent infections, especially things like sinus infections, asthma, bronchitis, those are very common things that you'll see with people who are exposed to a moldy building or have a mold sensitivity. Even ear infections, those are pretty common, especially in kids. Your allergies tend to be worse too. You can always tell when somebody's got allergies. They get what we call allergic shiners. They get those little dark circles under their eyes. They get puffiness and bags in there. If they have a mold exposure, that will be worse and it'll be present all the time. Certain times of the year, it may be worse, especially coming up on the fall as the leaves start to fall and die. That outdoor mold is going to be more present and your symptoms could then be a little bit worse as well. Talks a little bit about autoimmune issues, but there's something called molecular mimicry, where if you have a infection and then you get another infection. So we learned a lot about this with COVID, but we knew about it prior to it, but COVID just solidified what we knew. If you have a virus that comes in, it can act like another virus and they can change their shape and their structure. And so then they can reactivate each other. So we know COVID reactivated a lot of Lyme infections for people, and Epstein-Barr virus and herpes family viruses got reactivated with this new virus. The same thing can happen with mycotoxins. They can reactivate a lot of these different things. And then there's something called mast cell syndrome. This is probably one of the worst things that I see that happens to people who've been exposed to mold. Think of it as a major allergic flare-up. Oftentimes you'll see what we call oral allergy syndrome that occurs, where they start to have reactions to anything they put in their mouth. So before, they might have just started to have issues with dairy or gluten or broccoli or whatever food it was. But now, as their immune system's declining, they're starting to have reactions to all foods. It doesn't really matter what they're eating, chemicals, perfumes, cleaners, things like that. Some people will even have problems with their clothes touching their skin. The allergic response can be so intense. And that happens because of their histamine levels. So their histamine levels go up. They have a rise in something called tryptase and leukotriene-4, and it creates this massive allergic response. And it takes a ton of antihistamines to calm it down, but they also don't tolerate a lot of medications either. So it becomes much more challenging for us to treat them because everything we give them, they have a reaction to. And it's not necessarily a true allergy, as it's more that histamine reaction that's occurring for them. Respiratory symptoms are pretty common with people who have allergies or have mold risk factors. Oftentimes, we think if you have a mold allergy, you're going to have a respiratory issue. We think of asthma, we think of bronchitis or breathing issues. It's a small piece of it, but that's where mold comes in typically. We breathe it in, goes down into the lungs, flares up the lungs, and then goes every place else. But it is not the only thing. So if you don't have breathing problems, it doesn't mean that you don't have a mold issue. It's just one of those major things. Because we breathe in mold through our sinus cavity, it's very easy for mold to multiply in there. It's dark, it's moist, it's a great place for mold and fungus to grow. So it likes to stay in there. So when people have mold mycotoxin illness, there's something we call colonization. And so when we talk about colonization, we're talking about those mold spores growing inside the sinus cavity. So now, even if you get out of the moldy environment, you've become your own little mold factory, and you're just reproducing that mold and exposing yourself to it over and over and over again. And if we don't remove that mold toxin from the nasal passages, you'll never get better. Problem is, most ENTs don't recognize colonization as being a problem. It's not easy to find on a CT scan unless you know what you're looking for. So when we do a traditional CT scan, what we're looking for is something called opacification of the sinus cavity. And most ENTs will go, yeah, you got chronic sinusitis, big deal. They'll know when they're looking at it that it's mold or fungi, but they don't necessarily say anything, and they won't recommend surgery. But if they're doing surgery because you have chronic sinusitis, they'll take the fungus out and they won't ever say anything. And they won't flush the sinus cavity with antifungals, so the fungus just grows back and you continue to have the same sinus issues. It becomes a bigger problem. So sometimes we can kill this fungus with nasal sprays, but sometimes we have to actually go in and surgically remove it, especially if it's a large fungal ball that's in there. You can also develop nasal polyps. That's common with any type of allergy, but especially mold allergies will trigger more polyps. So if people have recurrent polyps, it's usually a good indication for us that we should be looking at mold as an issue for them. And then if they get aspergillus in their lungs, it can grow there and they will have more and more breathing problems. We can see that on the CT scan. But again, most doctors won't do much about it. If they see this mass on the CT, they'll just follow it, because trying to go in and doing a biopsy of that lung to see if it actually is fungus is very challenging. It's very risky to do that. But there are ways that we can give medication to clear that out of the lung. But usually by the time people have aspergillus of the lung, they're pretty sick and their immune system's pretty depleted. There's a biofilm that can occur around any bacteria, virus, or parasite, and also on a fungus. So think of the film that gets on your teeth if you go a day or two without brushing it. It's very similar to the biofilm that encapsulates these bugs, and it's a protective coating. So it goes over these things as a shield, so that if we're giving you an antifungal, if we don't strip away the biofilm first, the antifungal can't get it in the inside of it to actually kill it. So it just kind of goes, you can't get me. So we have to get that biofilm off. Sometimes you don't know if somebody has a biofilm or not. We can see it if we do a nasal swab. We just assume most of the time they do. So we'll use enzymes to break that up to help protect that. GI warfare. GI. Mold loves the gut. And so oftentimes people will present with GI issues, constipation, irritable bowel, bloating, diarrhea, gas, SIBO type symptoms. You eat a small amount of food, you feel like you've had this huge Thanksgiving meal, and then you look like you're 4 months pregnant afterwards. That's what SIBO is, small intestinal bacterial overgrowth. But you can also have CFO. You can have a fungal overgrowth, not necessarily just the bacterial overgrowth. You could have the fungus that grows inside of the gut. And now, thanks to the COVID times, we also know there's viral driven CFO, and the virus can get in there and cause the same type of symptoms. We don't always see that by stool testing. Sometimes we'll see the fungus. Most of the time we see the bacteria. It's rare we see the virus in there. So it can be a challenge sometimes to try to figure out which problem you're dealing with. But when there's mold issues, almost always people are going to complain of an upset stomach. They're nauseous all the time, or their stomach just hurts all the time. They're uncomfortable. They'll oftentimes avoid eating because they feel better if they don't eat versus when they do eat. And it can be one of or the only symptom that people have with mold issues. You can also see a white coating on the tongue. Most of the time we call it candida. People will think of it more as thrush. And you can get thrush, but typically if you're getting thrush, you're getting it because you've had an exposure to antibiotics. But if you chronically have thrush, we have to think about your environment. What are you getting exposed to? Is there that fungal overgrowth happening in the gut? Because if it's in the gut, it's in the mouth. And if it's in the mouth, it's in the gut. That's one track area there. So they share each other. So whenever we see that chronic thrush, we want to be thinking about mold as well. And if somebody's been on a gut protocol for a really long time and they haven't improved and they don't know about mold, that's when you really have to start thinking like something else is going on. We're missing something here. Hormonal chaos. Oh my. So there is a mold mycotoxin called zearalenone that is a known endocrine disruptor. So it disrupts the whole endocrine system, which then tanks the hormones. I've seen many women get exposed to mold and end up in what's called premature ovarian failure. So they could be 30 or 40 years old, their ovaries fail, they're no longer making hormones the way they're supposed to, and they go into menopause very early. On occasion, if we get the mold out, we can sometimes reverse that. If all of their eggs haven't been completely depleted and they're not ovulating simply because the disruption is happening through the whole endocrine system, we can get them back to having some cycles. It is a challenge, but sometimes it can happen. I actually have somebody who that happened to and then accidentally got pregnant. It can happen. It commonly will take out your thyroid gland, deplete the adrenals, and then the female and the male hormones will follow. Usually it's thyroid and adrenal first, and then the female and male hormones afterwards that'll be affected. I have had people who have had mold mycotoxins in their pituitary. Primarily gliotoxin is the one that likes to get into the pituitary. You can see it on an MRI often. You don't know it's mold, but you can see the pituitary is shrinking, or you see white matter brain disease there. And then we know that there's mold inside the brain and it's creating issues. So if the pituitary is affected, that's the main diva of all the hormones. So we're going to see downregulation of the hormones be affected as well. And then you have to get things across the blood-brain barrier to fix that whole process. You will see sugar instability with mold and sugar cravings, because as we kill off the mold wants to survive, and it survives by being fed sugar. So sugar, carbs, those kinds of things, those cravings will happen quite a bit as we're killing off mold. So it's really important to try to not eat sugar as much as you can. I know it can be a challenge. You can have things with honey or stevia or molasses. That doesn't feed sugar or feed the mold the same way sugar does. But you want to stay away from a lot of that white refined stuff. It's a challenge. Temperature regulation too. Oftentimes we think it's all thyroid, but it actually can be mold exposure that causes your temperature to be suppressed and have that really freezing cold all the time. And then as the mold comes out, your body temperature will start coming back to normal again. Aflatoxins. So aflatoxins are toxins that directly affect the liver. Each mycotoxin can affect the body a little bit differently. They affect the whole body, but some like to affect certain parts of the body more. Aflatoxins definitely create liver issues. So we always want to be detoxifying the liver as we're getting rid of these things, because they have to process through the liver, then they have to process through the gut. So if you're not pooping regularly, you can't get them out. So does anybody know what a healthy bowel movement is supposed to be like? Or how many we're supposed to have a day?
1 to 2.
3. For every large meal you have, you should have a bowel movement. So if you're eating 3 meals a day, ideally you should have 3 bowel movements a day. Most people are really happy if they have 1. When you have mycotoxin illness, it's not uncommon for people to go 4, 5, 6, 8, 10 days without a bowel movement. And then all those toxins are sitting in their gut and recirculating. And then they're backing up in the liver, causing more issues. So making sure the liver, the gallbladder, all of that is flushing out, and you're having regular stools is really important during this process. I'm sure everybody has seen the commercials for liver tox issues and liver cocktails and how it affects your energy, because it's all over social media. I think dose is the one I see the most advertised. It is true. If your liver is congested, you're going to recirculate hormones, which isn't going to be good. You're going to recirculate all your toxins, which is going to cause you to be more fatigued and have more brain fog and more energy issues. You're going to have a lot of skin issues. Mold likes to affect the skin as well. Part of that comes from the liver being toxic. So you can get a lot of rashes. You can get skin itching, hives, those kinds of things. Very common with all of that. So Chadium loves the brain. Chadium and gliotoxin love the brain. So they create brain on fire. They cross the blood-brain barrier. They cause inflammation in the brain. They cause memory issues, focus and concentration issues. They can actually cause the brain size to shrink as well. So we have that volume loss. When we have people who have volume loss at a young age, and we're really not sure why, and there's not a lot of family history for Alzheimer's and dementia, we typically look at toxins. We're looking at molds, chemicals, metals, things like that, but it's going to be chemicals and molds that do that most. Um, we will see a lot of lung issues with chadium. It creates apoptosis or cell death. So it causes the cells in the body to die, which then disrupts the mitochondria because the cells can't turn over quickly and regenerate themselves. And so when they can't regenerate themselves, that's where you have muscle pain and joint pain and fatigue, and you don't recover well from activity. And then there's an increased cancer risk with this particular mycotoxin as well. Gliotoxin actually can shut down the motility of the gut. It's called gastroparesis. So if the gut is no longer mobile, you won't be able to have a bowel movement. But gliotoxin is the one that does that the most. It gets in the gut and it gets in the brain. And we all know there's that gut-brain barrier connection, right? And the vagus nerve is in the middle. And so it can disrupt that whole process and cause a lot of issues for people. It is one of the main ones that drives mast cell as well. Ochratoxin A loves the kidneys, and it is one of the major ones that damages the kidneys. So if somebody presents with kidney issues, this is one of the first things that we're thinking about is this particular toxin and how it's affecting the kidneys. It can cause kidney failure and kidney cancer. It blocks your protein absorption, so you're not getting protein from your gut. And then it also decreases glutathione. It damages the male RNA, so we can see infertility and sperm issues with men that have been exposed to ochratoxin A as well. One of the big concerns that we have too is if somebody's being exposed to mold and it's shortly before or while they're pregnant, these toxins can be passed to the baby that's unborn. And if it's a female, her eggs can be affected. And this is how we say things skip generations with toxins, or the baby may not be affected now, but her offspring can be affected. It's because these toxins will seed in her ovaries and it can affect her future offspring. So it can be a real problem. Here's the zearalenone. This is a xenoestrogen, so it replaces estrogen in the body, but it doesn't do what estrogen does. So it takes up the place of it, but then it dysregulates the estrogen and doesn't allow you to actually utilize your estrogen. So this can cause infertility, reproductive issues. It can actually cause secondary AV heart block as well. And it's one of those that we don't think that much about either. So whenever we have unexplained fertility issues, we're looking at issues as a problem. Trichothezines and your favorite Stachybotrys, I'm sure, what we think of as quote unquote black mold. This is a big major one. It damages the bladder. It disrupts the DNA. So again, any pregnant person that's exposed to this can have offspring that are affected by it. It does increase your thirst and throws off your kidney, bladder, water regulation system. Also depletes glutathione and causes skin and hair changes. So this one can cause a lot of skin issues, hives, burning, itching, that kind of thing. We'll see a lot of hair loss with this one too. People will shed. And normally if they go to the dermatologist, they'll get diagnosed with telogen effluvium. We don't know why. Your body's stressed, you're just losing your hair, but this is a big one that'll cause that to happen. You can also have, what's interesting is a lot of bladder issues like frequency and urgency and leaking, especially for women. Men typically with this one will get a lot of bladder pain. Like they'll get bladder spasms and they'll have bladder pain, but they typically don't see urinary dripping or leakage or things like that. So some red flags you want to look for is the entire family sick? Is everyone in the household sick? If they are, that's a big concern. We always think of the environment. If they're not, it doesn't mean that it's not everybody. Like I had mentioned earlier, if you have relief when you're away from the home for a couple of days, that's usually a red flag that something's going on in the home. And then if you failed standard protocols that have worked for everybody else or worked for everything else you've done, but you're still struggling. Multiple diagnoses that don't make sense. That's a common thing as well. And then worsening symptoms despite using treatment. That's another really good indication that we're dealing with a mold issue too. And then environmental sensitivity. People with mold will also typically have EMF sensitivity. So electromagnetic field, all the things around the Wi-Fi and the computers, they tend to be much more sensitive to that. They'll also be much more sensitive to other things in the home, which you may talk about too, but like formaldehydes, things like that in new builds, they'll be much more sensitive to that if they have mold as well. They'll start to get sudden food allergies, the histamine, that mast cell reaction that we talked about a little bit. Light and sound will bother them. Cherry hemangiomas, those little red spots that we get, that's usually an indication that the liver's congested, and it can be congested by everything, but oftentimes we'll think about mold as that. We talked about the increased thirst already, the moodiness, the irritability, burning nerves. That's another one. Like people who get that nerve feeling, or they'll get this creepy crawly feeling, and then their nerves feel like they're on fire and things feel hot, and then all of a sudden it goes away. That's usually another good indication that there's probably some mold stuff going on. Here's not an entire list of mold symptoms, but a little bit more encompassing. Chronic dry cough that doesn't have anything to do with an illness. That's usually a mold issue. And if you've had mold and recovered from it, it doesn't necessarily mean your cough's going to go away. It is often, though, something that's irritated if somebody gets a mold exposure. Head pressure, headaches, eye pressure, fatigue, digestive issues, lack of motivation, brain fog, chronic sinus infections or sinusitis where they're just getting that inflammation there. Dizziness and lightheadedness, even vertigo to the point where you're feeling like the room is spinning. That's a common mold symptom as well. Joint pain that moves around, difficulty focusing and concentrating, especially with a mold hit. You walk into a grocery store, there's a mold hit, and suddenly you're just like, why can't I think? I don't know what's going on. Then you leave the building, and an hour or two later, you're fine. That's usually a mold issue that's going on. There are psychiatric symptoms and psychiatric disorders where people have been diagnosed with bipolar or manic or schizophrenia that are really mold issues. And once you treat the mold issues and get the mycotoxins out of their body, those psychiatric symptoms go away. So you have to have this clinical detective mindset, right? When you're talking about mold, not only for your body, but also for your house, you have to figure out where it is. And Andrew's going to share a lot about how to do that. But you have to start looking at the patterns. And I usually recommend people keep a journal. And just write down when you're getting your symptoms. Is there a pattern? Sometimes it's really nice to get an old calendar, like a paper calendar, and you can write your symptoms down on the days, because in that way you can open up the calendar and you can start looking and going, okay, where's the pattern? Okay, this is happening every day when I go to this office or every time I go to this school. You'll start to see those patterns, and when you can match them with the days, you'll be able to find things a lot easier. So whenever something doesn't fit the normal picture, I would say always think mycotoxin illness. Don't think just because you have a new build house that it's not a sick house. It can be. 100-year-old house, 9 times out of 10 is going to have mold. I don't care if they renovated it, made it look beautiful, put a new basement in, all of that. Over 100 years, at some point, it had water damage. There's going to be a problem with that. And if you're sensitive to that, you just may not be able to tolerate that. Somebody else might, you may not. If you walk in and you smell mustiness, there's something there. And if you're sensitive, you're going to have a problem with it. So if you go to grandma's house and grandma's house has that nice, sweet, musty smell, that's a moldy house. The hardest part for us is to say, Grandma, I can't come to your house because it's moldy, right? You don't want to hurt their feelings, but you also can't continue to expose yourself to a building that makes you sick, because every time you get that hit, it's going to set you back. So learning to develop clear boundaries is really important for people, and it's one of the hardest things to do. Why does this matter? Well, your health matters. 24% of us have genetic susceptibility to it. What's the rate of cancer these days? It's pretty high. For those people who have mold mycotoxin illness, it's a given. It's not if you get cancer, it's when you get cancer. So it's really important for you to figure out what's going on, fix the immune system to help prevent you from getting heart block or cancer or MS or ALS, and all of those really chronic debilitating diseases that happen. When people tell you it's all in your head, that's a good time to run from that practitioner and to also start going, wait a minute, something's really wrong with me, because just because they can't figure it out, they're going to tell me it's all in my head. But that's usually a good detective moment to say, I've just got to find the right person to talk to and figure out what's going on here. And remember, if we've created something to be a biological weapon, we've created it to outlive anything that we can do to it. So it's not going to be a quick fix. It's not going to be like I'm going to take a month of something and it's going to work. Mycotoxin illness is usually a 2 to 3 year process to get over it. And that's after you find the place that's making you sick and you clean it up and you fix it or you get out of it. So it is a long-term issue. It's not a short-term issue. So the bottom line, if you're a practitioner, I think we need to be looking at mycotoxin. You need to learn about mycotoxin because it's everywhere. Andrew can correct me if I'm wrong, but over 75% of our buildings have some kind of mycotoxin illness or have some kind of toxicity these days in them. Different climates are a little bit different. So it is important. It is a problem. And if 24% of the population has this genetic mutation, there's a large portion of people that are going to get sick from this. So it's really important. Finding the root cause is also important. We don't always just want to say, oh, it's just mycotoxin illness, because it normally never is just mycotoxin illness. There's something else that was underlying that allowed your immune system to get depleted to open you up to mycotoxin illness. And now you just have a whole slew of things. So really finding that root cause is important. And then linking the environment back to the illness. I don't think we pay enough attention to keeping our environment clean and healthy. We don't talk about dirty electricity. We don't talk about EMF. We don't talk about all of the cell towers that are everywhere. And we need to really be having a really solid, good, healthy environment for all of us to live and work in so that our bodies can stay strong. Mycofolinic acid is a mycotoxin that tells us if there's live mold someplace versus dead mold. So whenever we see MPA on a test, we know that person's been exposed to live mold. It's not just dead mold and you're just sensitive to it. It is live and you need to figure it out. You need to find it so that it doesn't continue to make you sick.